Video we will be talking about the depersonalization or derealization disorder. This is actually an awareness video which covers the topics such as what are the symptoms, causes, and what are the treatments given for this particular disorder. Depersonalization disorder is a mental health condition that's now formally known as depersonalization derealization disorder. This updated name reflects the two major issues people with DDD experience. The first one is depersonalization. It affects how you relate to yourself. It can make you feel as if you are not real. Derealization affects how you relate to other people and things. It can make you feel like your surroundings or other people are not actually real. Together, these issues can leave you feeling distanced or disconnected from yourself and the world around you. It's not unusual to feel this way from time to time, but if you have DDD, these feelings can linger for longer periods of time and get in the way of day-to-day activities. Moving into the causes of depersonalization and derealization disorder. The exact cause of depersonalization derealization disorder is not well understood. Some people may be more vulnerable to experiencing this disorder than others, possibly due to genetic and environmental factors. Heightened states of stress and fear may trigger episodes. The symptoms of depersonalization derealization disorder may be related to childhood trauma or other experiences or events that cause severe emotional stress or trauma. There are certain risk factors that may increase the risk of depersonalization and derealization disorder, and they can include certain personality traits that make you want to avoid or deny difficult situations or make it hard to adapt to difficult situations. Then severe trauma during childhood or as an adult, such as experiencing or witnessing a traumatic event or abuse. Severe stress, such as a major relationship, financial or work related issues. Then depression or anxiety, especially severe or prolonged depression or anxiety with panic attacks. And using recreational drugs, which can trigger episodes of depersonalization or derealization. Now we will be discussing about the symptoms of depersonalization and derealization disorder. The symptoms usually begin in the mid to late teens or early adulthood. Depersonalization derealization disorder is usually seen rarely in children as well as older adults. Now moving into the symptoms of depersonalization disorder. The symptoms include feelings that you are an outside observer of your own thoughts, feelings, or your own body parts or your own body. Then feeling like a robot or that you are not in control of your own speech or movements, or emotional or physical numbness of your senses or responses to the world around you. So these people also have a sense that their memories lack emotion and that they may or may not be their own memories. Now moving into the symptoms of derealization disorder. The symptoms include feeling of being alienated from or unfamiliar with their own surroundings. For example, like they are living in a movie or in a dream. Then feeling emotionally disconnected from people you care about, as if you were separated by a glass wall. Then the surroundings that appear distorted, blurry, colorless, or artificial. Then they have distortions in perception of time, such as recent events feeling like distant past. These episodes of depersonalization and derealization disorder may usually last hours, days, weeks, or even months at a time. In some people, these episodes turn into ongoing feelings of depersonalization or derealization that may periodically get better or worse. Moving into the assessments of depersonalization and derealization disorder, the diagnosis is based on the self-reported experiences of the person followed by a clinical assessment. Psychiatric assessment includes a psychiatric history and some form of mental status examination. No laboratory tests for depersonalization derealization disorder currently exist. The diagnosis of depersonalization disorder can be made with the use of certain interviews and scales, and one among them is the structured clinical interview for DSM-4 dissociative disorder. It is widely used especially in research settings. This interview takes about 30 minutes to 1.5 hours depending on the individual's experiences. The other scale is the dissociative experience scale. It is a simple, quick, self-administered questionnaire that has been widely used to measure dissociative symptoms. The next one is the dissociative disorders interview schedule. It is a highly structured interview which makes DSM-4 diagnosis of somatization disorder, borderline personality disorder, and major depressive disorder, as well as all the dissociative disorder. The last one is the Cambridge Depersonalization Scale, which is a method for determining the severity of depersonalization disorder. It has been proven and accepted as a valid tool for the diagnosis of depersonalization disorder in a clinical setting. It is also used in a clinical setting to differentiate minor episodes of depersonalization from the actual symptoms of the disorder. The goal of treatment is to address the stressors that trigger the symptoms based on the person's general health triggers and symptom severity. The healthcare provider plans their treatment. The treatment often includes a combination of psychotherapy. Psychotherapy, which is also known as the talk therapy, is the main treatment for dissociative disorder. Your provider may opt for one or more of these methods, and one among the methods of psychotherapy is the cognitive behavioral therapy. CBT focuses on changing thinking patterns, feelings, and behaviors that are not serving the person. The second one is a dialectic behavior therapy. DBT may help with severe personality disturbances. It may help the person to tolerate difficult emotions, including dissociative symptoms. The third one is the family therapy, which can also help the group learn how to recognize the signs of a recurrence. The last one is the creative therapy, which includes art or music therapy that can help them to explore and express their thoughts and feelings in a safe and creative environment. Other treatment methods include medication and relaxation techniques. Mindfulness can help the person to tolerate their symptoms. Then the next one is clinical hypnosis, also known as hypnotherapy. This treatment method uses intense relaxation, concentration, and focused attention. The goal is to achieve an intense state of awareness. The provider can help them explore deep thoughts, feelings, and memories, and it can also help to find the root of a problem. The next one is medication. Actually, there is not a proper medication for depersonalization disorder, but treating depression or anxiety can help. Your provider may prescribe antidepressant or anti-anxiety medication such as desipramine, also known as norpramine. It is not possible to prevent the disorder completely. It might be helpful if we start treatment as soon as the person begin to show the symptoms in their early stages. Furthermore, early intervention immediately following a traumatic event or a stressful experience can actually help reduce the risk of developing a dissociative disorder further. Thank you for watching the video.